Let me tell you something that happens in my clinic more often than you might expect. A couple comes in. They have been together for years, sometimes decades. They care about each other genuinely. There is no crisis, no betrayal, no obvious fracture in the relationship. But something has quietly shifted. The warmth is thinner. The closeness that used to feel natural now feels like something that requires effort. And the man, more often than not, has no idea what changed. So I asked the woman privately, carefully, whether there are things she wishes were different in their intimate life. And almost every time, the answer is yes. And almost every time, she has never said a word to him about it. Not because she does not trust him, not because she does not love him, but because she does not know how to say it without hurting him, because she tried hinting and it did not land. Because at some point she made peace with the idea that this was simply how things were going to be. Gentlemen, what she is protecting you from is also what is quietly creating distance between you. My name is Dr. Narita, and today I am going to tell you the 3 most common mistakes men make in their intimate lives. Mistakes that affect not just physical connection, but emotional closeness, dignity, and the overall health of a relationship. I am going to tell you what they are, why they happen biologically, and exactly what to do differently. She may never bring this up, but that does not mean it is not costing you both something real. Before we go further, please hit the like button right now, subscribe if you have not already, and drop a comment telling me where in the world you are watching from. This community is full of men who are genuinely trying to show up better, and I am grateful for every one of you. Let us get into it. Before we get to the 3 mistakes, I want to dismantle something first. Most men who make these mistakes are not careless. They are not selfish. They are not indifferent to their partner's experience. In the vast majority of cases, the men I work with are genuinely loving, genuinely trying, and genuinely confused about why something that should feel natural has become complicated. And that confusion comes from a myth that most men absorbed somewhere along the way, the belief that good intentions automatically produce good results in intimacy. They do not. Not because intention does not matter, but because intimacy, particularly for women, and particularly in the context of long-term relationships, is governed by factors that good intentions alone cannot address. It is governed by biological timing, by emotional safety, by the quality of presence brought into the room, and these things require awareness, not just effort. The men who make the greatest difference in their partner's experience of intimacy are not necessarily the most experienced or the most confident. They are the most attuned, the most willing to understand rather than simply to perform. And that attunement, that understanding is exactly what today's conversation is designed to give you. Mistake number 1, you are skipping the most important part. If there is one mistake that underlies almost every other intimacy challenge I see in couples over 50, it is this one. Men move too fast. Not because they do not care, because of biology. And here is what I mean by that. The male sexual response system is, by design, relatively rapid. Arousal can build and peak in a matter of minutes. This is not a flaw, it is simply how the male body is wired. But the female arousal system operates on a completely different timeline, and the gap between those 2 timelines when it goes unacknowledged is where most of the disconnection happens. Let me give you the biology clearly. For a woman's body to be genuinely ready for intimacy, not going through the motions ready, but physically comfortable, naturally lubricated, and neurologically present, it requires what researchers call an arousal arc, a gradual build of physical warmth, emotional safety, and sustained attention. This arc cannot be rushed, and it does not begin when you enter the bedroom. For many women, particularly after 50 when estrogen levels have shifted, this arc can take 30 to 45 minutes to fully develop, sometimes longer. And the beginning of that arc is almost never physical. It starts hours earlier, in the quality of the day you have spent together. Did she feel attended to? Did she feel that her thoughts and feelings mattered to you today? Did she laugh with you? Did you say or do something that reminded her she is valued not just as a partner in the practical sense, but as a person you genuinely delight in? Those moments are not separate from intimacy. They are the beginning of it. And when they are absent, when the connection goes directly from the routine of daily life to the bedroom, her nervous system is simply not there yet. Her body may cooperate partially, but the full experience, the one where she is genuinely present, genuinely responsive, genuinely connected, that requires the arc to have been built, I worked with a man in his early 60s, I will call him Robert, who came to me genuinely bewildered. He told me his wife had described their intimate life as feeling mechanical, and he had no idea what she meant. He was attentive, he said. He made an effort. When I asked him to walk me through a typical evening, the picture became clear immediately. Dinner, television, a direct move toward intimacy with no transition, no moment of real connection in between, no conversation that went beneath the surface, nothing that said to her nervous system, you are safe here, you are seen, you can let go. The bedroom experience was not the problem. The hours before it were. I gave Robert one instruction for 2 weeks. Ask your wife one genuine question every evening, not about logistics, but about her, how she is feeling, what she is thinking about, what was hard today and what was good, and then listen with no agenda. He came back 3 weeks later looking like a different man. I do not know what happened, he said, but she is different. She was not different. She was finally arriving, because the ark had been built. Practically speaking this week, start 1 hour earlier than you think you need to, not with anything physical, with presence, with attention, with the kind of conversation that reminds her she is more to you than a person you share a house with. That is where intimacy actually begins. Mistake number 2, you have stopped communicating inside the moment. This one is quieter than the first, less obvious, but in many ways more damaging to the long-term quality of intimate connection. Most men, once a pattern is established in their intimate life, stop asking questions inside the experience. They find what seemed to work at some point, and they repeat it reliably, consistently, with the best of intentions, and they do not notice because she does not say anything when what used to work quietly stops working. Here is the biology that makes this so important to understand. A woman's body is not static across her lifetime. Hormonal changes through perimenopause and menopause significantly alter sensitivity patterns, physical comfort, lubrication, and what kinds of touch feel pleasurable versus uncomfortable. What was genuinely enjoyable at 45 may feel completely different at 55 or 62. This is not a failure of either partner, it is physiology, but it requires ongoing awareness. Beyond hormonal changes, stress affects the body's response. Sleep quality affects sensitivity. Emotional state affects physical openness. What she needs in any given moment is shaped by factors that shift constantly, and the only way to know what those are is to remain curious, attentive, and willing to ask. I want to be direct here, because this is where many men feel uncomfortable. The most intimate thing you can do inside a moment of physical closeness is to stay genuinely curious about her experience. Not performing, not executing a rehearsed approach, but actually checking in warmly, naturally, without making it clinical to understand what is landing and what is not. What feels good right now? What she wants more of? That curiosity communicates something that no technique ever could. It communicates your experience matters to me. Not in the abstract right now, in this moment. I care whether this is good for you. I worked with a woman in her late 50s who told me she had been quietly enduring discomfort in intimate moments for over 2 years without saying a word. When I asked why, she said he seems so confident about what he is doing. I do not want to make him feel like he has done something wrong. That kind of silence, protective, loving, completely counterproductive is what happens when a man stops creating space for honest feedback inside the experience. The solution is not complicated. A simple, warm, genuine check-in. Is this good? What would feel better right now? Tell me what you want. Spoken not with anxiety, but with the confidence of a man who is genuinely interested in the answer. When she knows that honesty is welcome, that you will not be deflated by a redirect, that you will receive her feedback as the gift it is, she will tell you exactly what she needs, and everything will improve. Practically this week, the next time you are intimate, ask one genuine question about her experience. Not at the beginning, not at the end, but during. Let her answer. And let her answer change what you do next. That shift alone will transform the quality of what you share. Mistake number 3, you disappear after the moment ends. This is the mistake that men most consistently underestimate, and the one that women most consistently feel quietly, without naming it as a form of rejection. Let me describe what it looks like. The intimate moment ends, and within minutes, sometimes seconds, something shifts. Attention moves elsewhere. A phone appears. Sleep comes. The conversation that began in warmth closes abruptly. And she is left lying beside you, physically close, emotionally alone. She probably will not say anything, She will likely tell herself it does not matter. But something in her nervous system has registered a message that she did not consciously choose to receive. The closeness was only for the physical moment. Once that was over, so was the connection. Over time, this pattern does something insidious.